Good morning, welcome back at ECCMID TV, brought to you live here from Pavilion 1 at the ECCMID Congress Center in Lisbon, Portugal. My name is Judith Cohen, I am hosting the ECCMID TV broadcast series, and I'm very pleased to be introducing my next guest who has come here live in our studio, Nico Mutters, who is a professor and a medical director at the Institute for Infection Control and Public Health at Bonn University Hospital, and also known probably better to many of you as the scientific coordinator for EUCIC. Welcome to you, Nico.
Thanks for having me.
Happy to have you here in our studio. So let's talk a little bit about EUCIC. EUCIC is the European Committee for Infection Control. How long have you been scientific coordinator?
Well, the EUCIC was founded in 2014, and I started at 2015 as scientific coordinator and became part of the steering committee of EUCIC. And since then I've been working there, well, freely, so to say.
Can you tell us a little bit more about the mission of EUCIC?
Yeah. As you may know, or the viewers as well, we have the EUCAST from ESCMID, so the European Committee on Antimicrobial Susceptibility Testing. And this was formed already decades ago, I guess. And this was formed in the beginning with the foundation to improve and standardize antimicrobial susceptibility testing in Europe or throughout the world. And when we felt the need that infection control with rising antimicrobial resistances of viruses spreading worldwide, that we need to do something similar within ESCMID for infection prevention and control. So we wanted to standardize infection control measures and interventions throughout Europe, and we can do that by research and education, especially by education. And this was our goal, our mission that we started with. But compared to the microbiology susceptibility testing, it is very different, the situation in Europe. Who is doing infection control? Sometimes it's the pharmacist in France, for example. Sometimes it's medical doctors. Sometimes it's the microbiologist.
I can imagine politics is also involved.
Yes, and politics is a big influence on that, and national regulations. So it's a very diverse and heterogeneous field. So that, and many countries actually do not have the specialty or do not even have real training programs on a local level. So when we found that there's actually a big need for education, we decided to start to create a training program, which was a massive endeavor, so to say, and took us a couple of years to develop the curriculum and to build it up, to find universities that would be willing to host such courses and all these things. And we used the ESCMID network for that.
And who would you like to train? Is it more the younger clinicians, or which people need to be trained to get more into the preventative measures for infection control?
Yeah, that's a good question, because it's not so black and white. Because in some countries it's indeed the physicians, in other countries it's mainly the nurses or the pharmacists who are doing infection control. So the infection control program that we started, the training program, is open. It's not only for medical doctors or only for nurses, it's open. So everyone can basically apply for that. And that's why we formed the curriculum, well, tailored to those people who later on in their healthcare setting will do infection control, no matter what their background is. But we wanted to teach them in the basic infection control measures and the advanced methods that you use and that you need in a hospital or healthcare setting to, well, terminate an outbreak, to do proper surveillance, to actually be aware of what kind of problems are going on in your setting. So it's really a full training program over 2 years, covering all major aspects and basic aspects of infection prevention and control. And it does not matter if you are doing that later as a nurse or as a doctor or a pharmacist.
So the basic principles of infection control, they apply to everyone, but also to every country.
Indeed. Indeed. That's why. So we created this away from national regulations as well, because this makes it very politic. But that's then we would not be going anywhere. We need to transfer the knowledge, and people, of course, have to look at the national situation, but they need the knowledge first. And in many countries, there were no national training programs available. So, but we started that in English, obviously. However, of course, in Europe are many languages present, not only English, and even especially in infection control nurses, etc., not everyone is speaking English. So what we do is that we created a training program with mandatory advanced and basic courses, but also with the so-called local modules. So all over Europe we have local modules that can be in the local language. And we transfer also our experts' knowledge to those people who want to do a local module, but they can do it in their local language. So we provide some material and all these things, and also the advertisement via ESCMID. And in the hope that by doing this, even if people are not following the whole training program, they still can have a local module in their own language to get at least basic principles of infection prevention and control. And
are you seeing results back already, or is it too short day from the people who've done some training, or?
Well, obviously, if you only have a couple of days local training program, it's not enough for your whole career as an infection control specialist, obviously. That's not enough, that's true. Yeah. But we still hope that by focusing on some aspects of infection control in countries where at the moment none or barely something that people can do, barely courses to attend to, then I think it still can have a large impact.
Yeah. Well, can we name the elephant in the room? Of course, the EUCIC was founded before we really had a big outbreak in which infection control was very important. How have you experienced that this whole period, this time period? We're still not out of it, but
yeah, it's true. But I think it made the point in a way. If that is the only, it made the point in a way. Yeah. If that is the only positive thing that the pandemic did, is to make people aware that infection prevention and control is something that is not only focused on healthcare settings.
Yeah.
Before that, I think people just thought infection control is something that is done in the hospital. Yeah. And of course, it's the main, well, not even the main part, but obviously it's a major part of it. But infection control specialists as well had to adapt due to the COVID pandemic, because it was really the perfect storm. It has had and still has actually a massive influence on all our lives, also on a social level. And transmission to be disrupted was our primary goal in the hospital, well, since hundreds of years. But in the community, from a public health point of view, I think it's now very visible for everyone that disrupting transmission goes beyond the hospital and healthcare settings. Yeah. It affects all of us, and it's also in a One Health kind of sense that we need to think more. This was done in research before, but we have to think more about cooperating more closely. Because when the pandemic hit, many of my colleagues were asked to join in their local communities or even on national boards to advise politicians. Yeah. And I think that's a good thing, actually, because as you said before, these concepts do apply outside of the healthcare setting as well. If you know how to terminate an outbreak in the healthcare setting, there are different variables, okay, but the pathogen, the ways the pathogen is transmitted, you can apply that also to the community sector, to the public health sector. And the public health epidemiologists, I think this is the close cooperation that was sought during the pandemic and went very well, actually, with those specialists focusing on these interventions and measures, and those who are the experts, like the public health experts, focusing on how it is spread in the community. And it brought together people. That's maybe the only positive thing. Yeah,
yeah, because one of the objectives of EUCIC is to harmonize the basic principles of infection control in a pan-European manner, right?
Yes, exactly.
How did you experience that? Because, well, just being a lay, I think every country did its own thing. Is that how you experienced it as well? Or?
Yeah, I think there are some lessons learned here. So, or there need to be some lessons learned here after the pandemic, or it's still the ongoing pandemic.
Can you mention one of the biggest lessons we should take with us?
For example, it's not, I don't want to judge, because as a politician, you have to take into account many factors, not only infection control factors, but also other social, industry, I don't know, many factors. So politicians always have to weigh it against other. It's a very difficult task. It's a very difficult job to decide, especially when the pandemic is new and a new virus is occurring. What do I do? Is it a strict lockdown? Is it this? Is it that? Yeah. And we have to admit, we didn't have a lot of data because this was the perfect storm. We never had a pandemic that magnitude, except maybe the Spanish flu, but that was 100 years ago. Yeah. So that's difficult decisions to take, but that's also why it happened sometimes that many countries did different things. There was not a lot of standardization. Many apps were developed, for example, in the European Union. I don't know how many, let's say a dozen apps were developed, not one, why not one? Many apps were developed. Well, the evidence after that now has been analyzed and published shows that these apps weren't successful at all. So it was a lot of money spent for a thing that we didn't really use finally, because people were not really downloading them enough, people were not really using them enough because it drains battery or to whatever reasons. These apps were not communicating with each other, so if you're living in a border region, you travel between Germany and France and then your app doesn't work anymore, it wasn't really helpful. So we have to learn that. I mean, I think the overall idea was good, but it didn't really work. Also with vaccination, for example, there are two groups you want to vaccinate once the vaccine is available. First is the group that is the most vulnerable one, the old people that get the disease and have a high risk of dying from it. And we did that. I mean, we started with the nursing homes and the elderly patients. I think that was the right decision, definitely, because these were the one with the wild virus still, so before Omicron and the other variants, that had a very high risk of dying due to COVID. But then, if you want to control a viral spread in the community, then you have to think about who is spreading the disease. So that's the second group. Highest risk of being infected and highest risk of spreading the disease. Since the beginning of time, since the dawn of time, these are the young people. Because the young people usually are not so severe symptomatic. So they are not lying in bed, not able to move with high fever. They are still able to move, and those people are the ones that actually move. If you look at a 75-year-old before the pandemic, how many social contacts does she or he have? Not a lot. No. To be honest, most of them, in the mean, do not have a lot of social contacts and do not travel a lot. They stay within a radius of a couple of miles. That's it.
The young people are
But
all
look
over
at the 25-year-old woman or male, doesn't matter. Look at them. They have lots of social contacts. They're doing sports activities, doing this and that. They're traveling all the time. And they do not feel very sick in many cases if they get the disease. They're just having a little coughing,
so they miss
maybe.
The urgency also.
Yeah, but they don't they are not too affected by it. So these are the ones that are able to spread the disease, and also vice versa, because they have many contacts, at the highest risk of getting the disease. That is why I think in a vaccination strategy, we should have vaccinated the most vulnerable group first, but in many countries then we tried to go from 89 years to 79 to 78, so it took a long time before we actually vaccinated those who were spreading the disease. And that is something you could see, and you can learn from that, I think. If another pandemic will hit, of course, we have to deal with logistics, vaccine availability, all these things, but I think we have to deploy a different strategy. Vaccinate the most vulnerable group first, but then think about who is the group that has the most risk of getting and spreading the disease. And then you can control it after all, I think, better.
Yeah.
Because
is this something EUCIC strives to get ready for possibly being prepared for future pandemics?
I think it's one thing we have to be aware of, and I mean, we are a scientific society with ESCMID, and EUCIC is the committee that is committed to infection control. And I think definitely we have to take the lessons learned into account, have to adapt also the training program and train people indeed and teach them about that. I mean, I think it's one of our goals as well now. I don't want to say after the pandemic, but after the first years of the pandemic.
Are you concerned that the lessons that were learned this pandemic will go to waste, or I mean that people will just think, well, we learned a lesson, but that it won't translate into being prepared for future pandemics, epidemics?
That's a psychological thing of human behavior that tends to happen, that people after a while tend to forget. But I think it's when you look from the point of view of science and the scientist's point of view, then I think it's our job as scientists to now evaluate the evidence, to see is a lockdown effective, for example, or is prohibiting small group gatherings effective? What is the most effective intervention? What was the most effective intervention? I think that's our job.
And the science on that has progressed immensely in the past 2 years.
Yes, definitely. Yeah. And so I think we can, from a scientist's point of view, really learn a lot from it. And And I think that even people may tend to forget. I still think we could be and can be and hopefully will be better prepared for the next pandemic, because there really are some lessons learned, and I think we all did learn something. And but we have to be, we cannot do it alone, because you see there's lots of social behavioral science, all these things, public health, they are intertwined a little bit. So if you have a perfect storm, a pandemic that affects both private, social, every life in different ways, but in a real high, in a big magnitude, then you have to think about other parts of science. It's not the infection control specialist alone who can control this pandemic. He needs other people from other sectors. Also the politicians, they need to be advised from different groups. The infection control specialist, obviously, I think it's a good advisor in that kind of scenario, but also the ones that are expert on human behavioral, psychological effects of a lockdown. All these things needs to be considered. I mean, there was an increase in violence at home, especially towards children and women due to lockdowns. This is something a politician needs to consider as well. As an infection control specialist, I would say, okay, that maybe does not concern me. It's not an infectious disease, but it does concern the society.
Of course.
And we have to take that into account as well.
It's so much bigger than just the
It's
science.
so much bigger than just one particular aspect. So that's also something we have learned, I guess.
Well, so this ECCMID, EUCIC is also organizing a number of sessions, right?
Yes.
I thought there was also a guidelines session. Do you care to share a little bit about that?
Yeah, sure. As I said, one of our major goals was education, and still is, but the other part is science. It's scientific society, so it's research, and it's guideline development to provide guidance to others. And so we are in the middle, and we still have created, together with others, of course, some ESCMID EUCIC guidelines. For example, we are currently in the process of updating the 2014 published guideline on multi-drug resistant organisms and how to control the spread of them in the healthcare facilities, in the healthcare setting. That is also a huge amount, because the old guideline took into account all published evidence up to 2011. This has been 11 years now, or more than a decade. And antimicrobial resistance, if you look at the last decade, I mean, there are thousands of papers published. So it's a tremendous work to do, but I think it's very worthwhile, because many things we did not know 10 years ago. There was not a lot of evidence, not a lot of studies published, and we are much further now. I think we will have more insights on how to control those organisms, for example. EUCIC also was a part of the recently published guideline on testing of SARS-CoV testing. So this is also, I think, an important guideline. Was done by Evelina Tacconelli from Verona.
Specifically on the testing.
Yes, specifically on that. I mean, there will be, of course, other many guidelines on COVID, I guess.
Not other EUCIC's
yes, but we focus on the parts that somehow affect infection control and strategies and interventions, and testing can be one of this, of course. I mean, it's not about the diagnostic part in this case, so we are not comparing the effectiveness of diagnostic markers or something. That's something obviously the virologist would do. So we are focusing on what effect has the testing on in terms of infection control, for example.
So are there any other ECCMID program elements that you're specifically looking forward to attending yourself?
Oh yeah, sure. I
Maybe
mean,
more on the personal
I'm actually
level,
very happy that it takes place. You know, I mean, it was online for a couple of years, and it has not the same feeling as it has if you are really on site. You get to meet people again. That's very nice. So I'm actually looking forward.
Are you happy with the level of infection control?
Yeah, I think it's fine. I mean, we are all wearing the mask. It's a huge. It's really huge here, so it's very large. So good ventilations in place. So I think that's fine. I mean, I guess that's okay. And the vaccination rate is very high of those attending here. I guess because most of them are professionals working in the healthcare setting. So I'm not too worried about that, I have to admit. No, I'm really looking forward also to watching sessions from other areas. That's the good thing at ECCMID. I think you can walk into sessions that you are not usually familiar with, but you learn something new. It broadens your horizon. You get new ideas, and that's great. That's something you have in the online setting, not so much. I think it worked very well, but I think this is much better. Yeah,
and there's always the cross-link with your own research topics or your own clinical topics.
Yes.
Well, Thank you so much, Nico, for coming
May
in.
I be a little bit bold? Sorry to interrupt you.
Yes, you may be very bold.
Because I want to take advantage of this real quick, because we have a job opening at EUCIC.
We have a job opening.
So if you are...
Maybe take a look at the camera. If you're addressing our viewers.
If you are a young trainee...
Oh no, take a look at that camera.
This camera? Okay, there are three camera guys, sorry for that. So if you are a trainee somewhere interested in infection control, we have a job opening for a EUCIC Research Manager Infection and Training Program Coordinator. So it would be very nice if you apply. The job can be found on our website. It's until in the middle of May or something. You can find it under current activities and under jobs at ESCMID EUCIC. So it would be very nice. We would be very happy to have you. So sorry for that, but I couldn't just not take that opportunity.
We love having bold people on our couch. We keep it lively. Well, thank you so much.
Thank you very much.
Thank you for sharing all your thoughts and views and all the good work that EUCIC is involved in. Thank you all for watching. We will be back at noon, and we will be back with one of our very popular program elements. We will be back spinning the lucky wheel of fortune. So please make sure you enter via the Zoom link that has been made available on the platform. There's also here in the ESCMID World Village, we have a number of signs with QR codes which contain the link to the Zoom. And with any luck, I will be receiving or inviting you here on my screen live in the studio, and you will be selected to let me spin the lucky wheel of fortune for you and get the opportunity to win some really great, cool ECCMID and ESCMID must-have gadgets, and even big prizes are to be handed out. So please join, and hope to see you at noon.